Welcome to the Medicare Secondary Payer Resources Locating Help webinar. This is the Medicare Secondary Payer Tips and Tricks webinar. MSP is one of our top denials, so we want to help you locate resources, answer your questions. Maybe those resources will help you answer your questions. Basically, we want to get you through some of the different tips and tricks to get through the process. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today, I'm joined by Leanne from my team, and her goal is to answer questions put into chat or to ask them of me when we get to that section and to give you different links and information you may need. Remember that you can download the presentation from our website. It's in live events if you're on the call live today, or will be available in encore presentations in the future. Also, though, at the end of that particular presentation is the disclaimers for today, so you want to make sure you read those. Our goal is to help you avoid MSP denials and rejections. Again, part of that is the tips, the tricks to get through everything. We want to explain what MSP is, because that is one of the questions we did get, and I'll talk more about some of those questions. I do want to give you some WPS suggestions. I will let you know or clarify when it is a suggestion from WPS versus some of the other information which will not be a suggestion and may be mandatory. So you want to make sure that we have the right information there. Last, we do want to answer your questions, and those are going to be starting with the pre-submitted questions, and then we'll move to the chat questions. Couple of things. We were asked some information about Medicare Advantage plans as it relates to Medicare Secondary Payer. We will not be answering those questions. The reason for that is we work for traditional fee-for-service Medicare. We cannot provide information on Medicare Advantage plans and how their systems work to determine primary, secondary payments, how the claims processing information is, what information is needed on the claim. So any of that is off the table. You'll have to contact the individual plan to get that information. I want to encourage you to take time to add questions in the chat at any given time. I'll answer those at the end as time permits. In the meantime, we will focus on getting you through the information that you asked for in the pre-submitted questions, which is what the whole presentation is built around. So to do that, we have to start with explaining the Medicare Secondary Payer or MSP program. Why is this important? Well, as it states, this program makes Medicare pay after someone else has considered the claim. And we'll talk more about that in just a moment and using the proper terminology. But this is a huge savings to Medicare, and that's why it was enacted in the first place. It's also part of the federal regulations. So if you look up section 1862B, you're going to see Medicare Secondary Payer information. This is the actual Social Security Act. And in that, again, it does dictate all of these pieces. So it's something that we're all obligated to follow. Okay. Let me tell you that I'm going to give you a brief explanation, and there is a lot more information out there. For those of you that are not familiar with this, we actually do about an hour a month on Medicare Secondary Payer, and we offer recordings available to you on YouTube. They'll stay out on our website usually around 60 days, but I always recommend that you don't do the reliance on the website. Instead, go to YouTube directly and look at the Medicare Secondary Payer playlist available on our channel. Just my recommendation. Okay, let's start off by defining what Medicare means by Medicare Secondary Payer or MSP. First, commonly you'll hear the acronym used, and this is Medicare Secondary Payer. This does confuse some people. We actually had basic questions of how does MSP work? And I'm new to Medicare. So that means that as we begin to define this, some of this information will be a review for you. Others, this will be brand new. So again, let me say this again. MSP equals Medicare Secondary Payer. In other words, there is a primary payer before Medicare will consider the charges. That payer does not have to pay the services. What they have to do is determine whether or not they are going to cover the service. It's non-covered for them. Is this patient eligible for this type of service? All of those types of things. Does it apply to deductible, or do they have a percentage of payment, such as a co-payment or co-insurance? That's what we say, or that's what we mean by consider the services. When Medicare determines whether an insurance is primary, what they look at is the Medicare eligibility of the patient. How is that person eligible for Medicare? This then determines whether or not under group health plans or employment-based plans, which one is primary. We'll talk more about that. They're also going to look at the plan type. Again, group health plans are employment-based plans, or are they a non-group health plan or a non-employment-based plan? They're also going to look at whether the service is related to an accident, illness, or injury, and if Medicare should be primary. So let's work through these different options a little bit to help you understand how all of those play together. First, group health plans are one of the most common ways in which Medicare becomes a secondary payer. A group health plan is also known as an employment-based health plan. When we look at it, the person who's eligible for Medicare can be the person eligible for the group health plan, though they do not have to be. It could be their spouse, a legal guardian, or a parent, depending on how they're eligible. So we want to make sure that people are well aware of that. Then once we determine that they are eligible for a group health plan, we have to take it a step further. And what we're doing is looking at their Medicare eligibility. Whose Medicare eligibility? It's again the person that is eligible for Medicare. We say, hey, wait, are they Medicare eligible due to age, which is 65 or older? Yes. Okay. Now on that group health plan, is there 20 or more full-time employees or equivalent? If there are, then the group health plan is primary while Medicare is secondary. If not, then Medicare is primary and the group health plan is secondary. Continuing on, if the person is disabled under 65 and that's why they are eligible for Medicare, then again, we do look at the number of employees or full-time equivalent employees on that plan, and it goes to 100 or more, sometimes referred to as a large group health plan. So again, two different types. Eligibility is the same basic factor, except it's how are they eligible. The last type that goes with an employer-based plan or a group health plan is what is called end-stage renal disease eligibility. People with end-stage renal disease have a separate section under the Social Security Act that makes them eligible. It does not state anything to do with the number of employees, so yes or no, they're eligible. What it does state is that under end-stage renal disease, they have a 30-month coordination period. That means for the first 30 months, the other plan is eligible. And for anything once we reach 30 months, then Medicare becomes primary. So for the first 30 months, the group health plan is primary, then Medicare becomes primary. Also under end-stage renal disease, it says follow the same period of time for COBRA coverage. This is the only time COBRA coverage is considered. It's end-stage renal disease. And again, it's because it's in a separate section. So that is employer group health plans or EGHPs. Again, we're looking at first age-related, 20 or more, and the person is Medicare eligible at age 65. Under age-related is disability eligibility for your patient, and it's 100 or more full-time employees or equivalents. And the last one is end-stage renal disease eligible for Medicare. That is due to a 30-month coordination period. So hopefully that's some of your real basic starting points there. We also do have some that are not employment related plans. These are accident, illness, or injury related. So if you think about that, it could be things like workers' compensation, federal black lung, which is defined by the state, I'm sorry, which is defined by the Department of Labor. You also would fall into no fault liability. What they do then is the coordination of benefits system, which is the COB system. It actually contains a diagnosis, and anything within that diagnosis's related family would make it primary to Medicare. Okay, so it's an accident, illness, or injury as defined by a certain diagnosis. That diagnosis is put into the coordination of benefits system. That's when it's primary. If it is not related to that diagnosis, then Medicare is the primary coverage. So hopefully all of that does make sense. First tip for you, when you're looking at these types of insurances, make sure your billing system is listing it correctly. You may see a drop down. So you may say working age, and really it is working age or it is group health plan, but it's due to disability. And what did we just learn? They have different criteria, and because of that can cause different issues. Okay, so we have to make sure that this is getting defined correctly. Now, if you say, well, I don't actually know what that's being sent in as, that's where you might have to call and ask, hey, what was this code? Or you can look on the system in the Secure Net Access Portal or SNAP on our website and check out the code that you actually submitted. But without this information being correct, it can cause denials. It can cause us to add a second insurance to the file. That second insurance has a different type and is then investigated by the Benefit Coordination and Recovery Center and will stop not only your claims, but all claims from processing. So please make sure that you are getting your insurance type correct. That is your first tip. If you're unsure of any of these, I would recommend going back and reviewing that playlist that we had in there earlier. It's the Medicare Secondary Payer playlist. All right. I will also tell you one of the comment or questions that we got is someone said, I don't actually list this on my claim. Well, if you're using an electronic claim, which is how we commonly receive, about 95% of our claims come in electronically, you do a drop down and your software lists this. So you don't actually do anything about that. I can show you a crosswalk in a little while that'll tell you where it's actually at, and you can take a look at that. So give me just a minute, but I want to remind you that if you don't actually know where it's listed at, it might be that it's listed automatically by your system based on the drop down that you selected. All right, that's our first tip. Next, what other suggestions does WPS offer? Key thing here, highlight the word suggestions. None of this is mandatory unless I tell you CMS requires it in or CMS does this because, then it becomes mandatory, okay? So first, CMS does indicate that you need to ask the patient a series of questions. These questions are to verify if they have a different payer and also does that payer meet the criteria, such as the number of employees to be primary. CMS calls this a logical list of questions. We gave you on the slide the Medicare Secondary Payer Manual, the chapter and section where you can find these questions. What CMS does not state is that you have to literally create this into a questionnaire or a form. They state you have to gather the information. These are suggested questions. They also do state that if you have an electronic system that contains this information, you can verify with the patient that this information is correct, but you do need to document whether you verified electronically or whether you printed on paper that this information is correct. Okay, so this is something that is very interesting and does happen. If you are not documenting that you are doing this and you are audited for Medicare Secondary Payer, you will have all monies taken back. Keep in mind the CMS requirement for these questions or this information is that you keep it for 10 years. This may be slightly longer or significantly longer than your state documentation requirements and other items you're required to keep. So do start with asking the patients. One of the interesting parts that was asked to me is how often do you have to do this? And in order to answer this question, I need to answer it in a twofold process. First, if the patient is inpatient, it's on every admission. It doesn't matter. They're coming in, it's a brand new admission, inpatient, you're going to ask this. If a patient is being billed on a UB04 or an 837I for an outpatient service, then it's at the start of every outpatient care of service. If it's a reoccurring service, such as PT, so you know they're going to come back, you know they're going to come back, you know they're going to come back, then it's at the start of care and every 90 days there following. CMS uses the CMS 1500 and 837P criteria slightly differently. What they state is as often as necessary to determine if the patient has primary coverage. WPS recommends that you follow the 90-day guideline as set forth for outpatient reoccurring services in a facility. Please note, I want you to highlight, circle, whatever you want to do with recommend. It's not a requirement. So there's a couple of recommendations we've already given you. I do also just would encourage you come out, take a look at this Medicare Secondary Payer Manual. I think it's got some great information, can help you. So I'm going to take a minute and just show that to you. So we're going to go to cms.gov. On cms.gov, this is part of Medicare. Under Medicare, we're going to go to the regulations and guidance. Now remember, this is our daily operating instructions. That's what the internet-only manual is. So you go to manuals. Inside manuals, we're going to go to internet-only manuals. And we scroll a little bit down and you look for the claims processing, or Medicare Secondary Payer Manual. And you're going to go like, okay, which chapter do I need? Provisions. If you're not sure if it's in here, I always recommend just Control F, hit questions, hit search. It'll walk you through specific questions relating to. Now in here, you're going to see a lot of times where it's mentioned, but that's not the actual chapter that has it in it. Let's go to chapter 3 for billing requirements, because remember, that's part of what we're talking about here. Sorry, I opened the wrong chapter at first. Oops. You can scroll through to find this information. It's actually down here in chapter 20, just so you know. But if you don't know that, you can always say questions. And again, go ahead and pop through this way. It will eventually bring you to the model admission questions, exceptions, all of that, and then it'll start walking you through some of the different pieces of information you need to know. Getting lots of information on it. But if we continue to scroll down, you will get to the actual online use questions, etc. Okay, well, this is what you're going to get online. Here's your insurance type. Talk more about that, and here's your model questionnaire. So CMS does require the insurance type to be provided online, and this is our online tool in the portal and in the eligibility area. Okay, so hopefully that all makes sense. I know I've given you a lot of information very quickly right there, but again, it's all within that chapter 3. One of the biggest questions we get asked is, does the name have to match? We're not talking about the patient name. What we're talking about is, does the primary payer's name have to match what's in the Medicare system? And the answer is yes. If the Medicare system uses Blue Cross Blue Shield, you need to use Blue Cross Blue Shield. Don't use BCBS. If it is Blue Cross or Blue Shield of an in-service state, That's what you want to keep. Why is that important? If the name is not an exact match, it will cause the system to add it to the file. If it adds it to the file, we talked earlier about what happens. All claims stop processing while the BCRC, or Benefit Coordination and Recovery Center, gets to do an investigation, and they're investigating whether it is a different insurance or the same insurance. So we really do recommend stop, check the portal, which is our online system, check direct data entry, also check HETS, HIPAA eligibility transaction standard. Pick one of those and check it. I will tell you the portal uses the HETS transaction. So if you're checking one, you're getting the same information, okay? If you're not sure what the HETS is, it is the HIPAA eligibility transaction system. You have to have a vendor. That vendor submits a request to the common working file and it is returned to you. So yes, you do want to have an exact match. If you're trying to use the WPS portal to find this information, again, you'll go to WPS.com. You're going to go to the login section. Now, I can't actually log in and show you anything in this because it has PHI and PII. What I can do is use the portal user manual to help you locate this information. So portal user manual. Once we come there, if you don't like a fast scroll, please look away. Scroll down, I'm going to come all the way down, and what I'm looking for is the header patient, the subheader eligibility, then there's an eligibility check section. If I select that, it will walk us through where all the information comes from. Again, I can continue to scroll down, and it says accessing eligibility. It will actually tell you what fields need to be completed to get this information. I'm going to continue to scroll down because one of the questions said, what is the difference between eligibility and supplemental information? The only time I know that you can see that is on this system. So I'm assuming you're asking me within our SecureNet Access portal what it is. That's right here in eligibility. The system automatically brings you eligibility information and supplemental insurance. This is not insurance primary to Medicare. This is the Medicare supplemental insurance. So eligibility is where you're going to find insurance primary to Medicare. Supplemental insurance is the tab that brings you secondary to Medicare, after Medicare. So hopefully that answers that question. If not, throw something back in chat. I do want to help you. I just am not sure what else you needed from that. All right, let's keep scrolling down just a little bit more. Once eligibility has been returned, you will see a variety of tabs. Now, this is real-time information, and you can see one, you're going to start off on the summary tab, then you're going to see white with blue writing or grayed out. Okay. If it's white with blue, that means we have information available for it. In this case, Part A deductible, Part B deductible would be examples. If you see it grayed out, in this case, the first one is MSP, or Medicare Secondary Payer, it means it's not applicable. Now, that doesn't mean that we can't keep scrolling and take a look at just what's there in general. So let's do that. Now, again, I recommend looking away if you don't like a fast scroll. All I'm doing is scrolling down until I see the term Medicare Secondary Payer, or MSP. What I'm looking for is what's contained on that section of the eligibility area. And so you can see here, MSP is circled, tells me what's a name, and it says the MSP provider types, not types, the MSP tab provides the following. So what are we going to look at? It's going to go through and give us all of this. Now, if you say, great, I got what I needed, group number, insurance type, and code descriptions, so make sure you're aware that this is also there. One of the questions we were asked is that some of the files appear to be incomplete. How do I get what I need from those? If it is not displayed, we don't have access to it either, so please don't call our customer service. They can't access it. You might need to call the Benefit Coordination and Recovery Center and ask them additional questions of them, but we don't have access to it, so we can't give it to you. And I'll show you in a little bit where to find that contact information for the Benefit Coordination and Recovery Center. Actually, we'll show it to you right now. So the Benefit Coordination and Recovery Center is again available on the CMS website. We're going to back out of the manuals. Come back up to the top. You're going to go to Medicare. And then you're going to scroll down on the left side and you're looking for Coordination of Benefits and Recovery. It's the second to last item on the left side. Once selected, note the right side changes. I find the easiest way to locate this just to go straight to the overview. Once I open the overview, I will have a left navigation column. Now I will tell you this column is very long. So again, we're just going to scroll all the way to the bottom because that's where the contacts information page is. Once that opens, you can see by scrolling down, you'll find there different pieces of information. So hopefully that answers those two questions fairly quickly. Next question or next set of information, next tip. Please make sure you file these timely. Medicare does not have a timely filing exception due to delayed processing of a primary insurance. What it is if there's a reason such as disability, mental health reason, something like that, that the patient couldn't inform you there is primary, that is different, and that we would allow for a timely filing waiver. But overall, just because the primary didn't process it within the time frame, no. And so what is our time frame? 1 year from the date of an outpatient service, whether it's in a hospital or not. This would include supplies, professional services, any of that. Otherwise, it's 1 year from the date of discharge or through date on an inpatient claim. Hopefully all of that makes sense. But please remember, this is not an appealable. If you get a timely filing, it's not appealable. It's also not going to grant you an exception. If there is no Medicare liability, stop. Tell me why you're billing the claim in the first place. If the primary paid it in full, do you need to bill it? Yes and no. So what does that mean? If the patient has an unmet deductible, yes, you need to bill it. That could be either the Part A or the Part B deductible. The patient can actually meet their Medicare deductible without ever paying anything when the primary already paid it. If you bill for a Part A inpatient service, you must bill it. You're going to bill it as a covered service. You're going to indicate on that service, and I'll tell you more about that in just a little while, that the primary did not pay because it applied to deductible, that the primary paid it in full, all of those different things. So yeah, you want to follow that. This makes the Part A benefit period continue, and the benefit period is how we measure the utilization of the Part A inpatient days. Because remember, there's a set number of days they actually get for coverage until there's a lapse. So yes, you will want to view it. Also, sometimes you want to bill it because the patient says, hey, can you bill that to Medicare? Sure. As soon as the patient says that, even though there's no liability, you need to bill it to Medicare. The last time is more of a cautionary tale. It's not a requirement. Did everyone catch that? It's not a requirement. If the primary takes that back, takes what back? The payment, and you never billed it to Medicare and it's now outside that 1 year time frame, it will be denied for timely filing. You're then only allowed to bill the patient for what you would have been paid should Medicare have made a patient, or what the patient would have owed you should Medicare have made a payment. Wow, that's a lot because you got to figure it out on your own. So I'm always going to tell you, file it timely. If someone takes their payment back, great. You've already got it on file. Now we can work with it. That's why we use the hand stop, and we really want you to consider the situations that you need to be in. Okay. sorry, I went the wrong way. Now, what I'd like to do at this point is keep compiling questions in the chat. You can see we have plenty of time, but I do want to go through a couple of the pre-submitted questions. I think they'll help explain, so hopefully that all works together. First pre-submitted question, how to submit the MSP online. Now, I didn't know with this person because they said they build both a 1500 and a UB04, or I should say 1500 837P or UB04 837I. So I actually built two slides. Because we offer this in different formats, I'll show you where it is, but I did give you a direct link to it right here. And then if you go to the next slide, you'll see the UB04 and a direct link to that also. But let me show you how to define that on our website. So our website is wpsgha.com. You're going to select from one of four areas, one or four lines of business as defined by CMS. A line of business part A is billed on a UB04 or 837I. A line of business part B is billed on a 1500 or 837P. This does matter. It is not about benefits. It is simply about billing and how you bill. Let's go ahead and start with part B because that's our first slide that was built in. So in part B, if I go to topic centers and I go to claims, I'm like, what do I want to look at? I can scroll down by topic and I can come to Medicare Secondary Payer. I'll see that there are three distinct items. I want to know which one to look at. I'm looking at the fact sheet. When we scroll through this fact sheet, you get a lot of information, and then all of a sudden you get to this area, which begins to explain every loop, all the items that are needed, where this goes on the electronic claim. So this may also help you if you have questions about where information should be versus the 1500 claim form. Now let's go ahead and do one thing. Let's just automatically move to the Part A line of business. It will tell us this does not apply to this line of business. This article right here does not apply to this line of business. So now we need to find the one that does apply. So we're going to go back to the topic center and back to claims. We are going to scroll back down to Medicare Secondary Payer. We'll see there are three items. And within this one, we actually have the billing procedures article, which explains lots of information you need to know. Okay. So because the systems vary so much and the type of claims require different fields, that's why we have two different articles. It's not something that easily carries over or transitions. So that's why we have the two different articles. I want to move to the CMS website. If for some reason you need to process a paper claim form for Medicare Secondary Payer situations, which can happen when there's two primary payers, we do need you to follow the internet-only manual paper claims processing instructions. Those are in the Medicare section, in the regulations and guidance section, in the manuals section, in the internet-only manuals area. Then what you have to do is go to the claims processing manuals and scroll down. And there are two distinct areas that you're looking for. These are different chapters. Chapter 25 is for the CMS 1450 or UB04. Chapter 26 is for the CMS 1500. And you want to make sure you follow those. In general, your electronic billing requirements are in Chapter 24, but this does not give you each loop and segment and all those different things. Okay, so that's why you have to go back to our website to look through those articles to figure out what you're doing there. The next question is, why am I seeing denials for missing coordination of benefits information? This one we cannot answer. A couple of things. I don't know what the denial is. I don't know what information is missing. I need an internal control number to look this up, except I can't access the system to do that. That has to come through customer service. So contact customer service with your internal control number. They'll be able to help you. It could also be something that You're putting all the information there according to you and according to your system, but for some reason it's not transmitting on those loops and segments that I showed you earlier. Then you would want to contact our electronic data interchange department, EDI. They'll tell you what's going on, what they see, what they don't see if something isn't coming through to them. I do recommend using our Contact Us page on our website to help you with that, and that's available in the top of the website. Next question. I have denials for no occurrence code when payment is zero but went to deductible. What occurrence code should be used? This is a 24 occurrence code with the date the primary processed the claim. A lot of people say a 24, how is that appropriate? It's because they're refusing to pay. Why are they refusing to pay? It went to patient deductible. That means they're not going to pay you. You're not getting money. It's processed. They're just not paying you. Okay, so that's what we look for. Then, we always recommend just put some information in the narrative field. Helps us a little bit should you need it. Is Medicare billed secondary when services and diagnoses are not related to the primary insurance? Let me state this. If it is an employer-based plan, then Medicare is always billed as secondary. There is no diagnosis related to that. Even if they have an end-stage renal disease diagnosis, it's still an employer-based plan. On the other hand, if it is a non-employer-based plan, this would be your no-fault liability, workers' comp, and black lung. If it is not related, then you will bill Medicare as primary. When this comes in, you want to make sure it's coded appropriately and has the right occurrence span codes, all of that, or the UBO 4A37I, because that diagnosis code can grab your denial. If you bill on a 1500 claim form and you're still billing it correctly, can a claim deny? The answer is yes, because the 1500 has no way to say, nope, this is a different diagnosis. You do need to then file an appeal to say the diagnosis is unrelated, even though it's within the family. So it just depends on how you bill before I can give you the proper answer on how to make sure that one gets billed. I did want to take a few minutes and just go through some of the other questions that were submitted before we start opening up for those chat questions. Do federally qualified health centers, or FQHCs, Medicare Secondary Payer, work the same? The answer is it works exactly the same. Here's why. It's from the Social Security Act, Section 1862B. So it's not anything different for the billing purposes, with the exception of the type of bill to indicate it's an FQHC. What is the process for Medicare Secondary Payer? This one was a little interesting to me because I wasn't sure what process you were talking about, so I don't have a lot of information. In general, there is a series of edits that are built into our system. These edits look for all of the information to be complete and to be accurate. They will look for payment information, and if any of this is missing, they will stop the claim from processing. So I'm not sure what process you're looking for. Also, another process that could potentially have been involved here is, how do I update the Medicare Secondary Payer file, or the Coordination of Benefit System? Now that system is updated by the Benefit Coordination and Recovery Center, as stated earlier, and I showed you the contact information area. The thing to remember with updating this particular set of information is that providers are the last resort for updating. That means that they have to have information from the primary insurance or the employer stating it's no longer an active plan. They can then send that to the BCRC, and the BCRC can update the file based on that. With that, it has to contain dates. When did it begin and when did it end? If it does not have those, then we cannot update that. This doesn't mean that you cannot get your claim processed. You can always build it to the primary and have them tell you, hey, this is not an active plan for that data service. That's not giving you an eligibility date though, a start and end date. So that one claim could then be billed for that data service for that patient stating, hey, Medicare, consider this primary, and you want to make sure you get that billed correctly. So I'm not sure which process. Hopefully I covered all of them. If not, I'll need to know which process you were talking about. Medicare does not accept type of bill frequency 7 for conditions on an 837P submission. Correct. These are professional services. Type of bill is not actually there, neither is condition code. So is a dispute the best way to have a professional claim reprocessed when the coordination of benefits have been updated to make Medicare primary or secondary? I'm not sure what you mean by dispute. I always tell you simply resubmit the claim. Not sure what you mean by dispute. If you're saying an appeal or something like that, it's not really an appealable issue. You're not going to have an MA01 on your claim form. If you do, absolutely you can file an appeal, but you could just simply submit a new claim now that it's not on file for that data service. So, how can I bill the annual wellness visit or AWV when Medicare is secondary? First, follow the primary billing guidelines. Bill their service however they tell you to. When you come to Medicare as a secondary, if you need to note a change, why are you not billing the same procedure code? Why are you billing a different dollar amount or anything like that? Why are you doing a carve out service? Then you need to note that within the patient's medical record explaining that, submit the charges according to the Medicare information with the primary payer information included per the note. So you're going to have an explanation of benefits. You're going to explain why it's different within the note. Then you're going to follow that information when you go to bill. How do patients notify you that Medicare will be the secondary insurance? And again, they don't notify WPS at all. We as a Medicare administrative contractor are not involved with that. The patient contacts the Benefit Coordination and Recovery Center or BCRC and lets them know. Once again, can a provider call the BCRC for the patient and get this updated? If the patient is sitting with you in the office and says, yes, update it based on this, then you are acting as a one-time appointed representative. And the answer is yes, so long as you do not have a vested interest in this, because appointment of representative gets a little tricky. Okay. Can you call and have it updated? The answer is not normally. So what is the situation in which you could? One provider, one time can call and have this information updated when the patient has passed away. After that, all inquiries about updates must come in writing with information from the primary insurance. So let me state that again. In writing with information from the primary insurance. So no, you can't just pick up the phone and give them a call. The patient can pick up the phone and give them a call. So hopefully all of that makes sense. What if the patient's primary insurance denies something for medical necessity or not covered? Then can Medicare consider it if it's medically necessary per the Medicare guidelines? Will they process and pay the claims? First, if it is not covered or not medically necessary, yes, Medicare can consider something. You do need to bill the claim stating that the primary denied it. Again, if you're billing on a 1500 versus an 837 versus a UB04 or their electronic equivalents, please make sure you use proper coding or know that you may need to send in an appeal, especially for the 1500 claims. Okay. Someone said, why are we asking for this form to be completed? And that was all I got. My assumption with this would be that what you're asking about is the Medicare questionnaire form. And the reason that you're asking for that to be completed is because it is required by the federal government to do this. This requirement is then translated and worked down into the daily operating instructions. And again, take a look in that Medicare secondary payer manual in chapter 3 for that provision. It's all set there. There's nothing we can do. You have to ask the question. Unless you're displaying information like, here's what we have, is this all correct? Then we're okay with it. You don't have to use the actual form. When does the BCRC need to be notified? Are they notified when it's a liability, meaning a patient fell outside a store and the store only has $500,000 or $5,000 medical pay, but it's paid directly to the patient? The answer is yes. You want to notify them because they will work to take back whatever portion of the money that needs to be taken back from the patient, because there may be clauses and other information that states the patient keeps that money. It could be for loss of work. It could be for a variety of things. So yes, notify them, let them know that, hey, this payment was made. They'll work to determine if money needs to be taken back. They'll actually start the recoupment, whether it's against a provider, against a patient, whatever the situation is there. Okay. So that brings us to the last of the pre-submitted questions. So our next item is for Leanne to start asking me some questions from the chat. Leanne, do we have any?
Tom, we do have a few questions in the chat. The first one is, we have seen that we get denials for MSP no matter if the workers' comp or liability is not related, and we have to appeal all of them.
Okay, that can happen, and I want to say that very clearly. That can happen because it's related to a diagnosis or a family of diagnoses. So if your claim, even rightfully, is billed with that family, guess what? Denies. Now, if it happens to be a 1500 or an 837P, there's nothing on the claim form that you can do to indicate it's not part of it. It doesn't work that way. It's not like, you know, the UB04 or the 837I where there's occurrence codes and span codes and all kinds of things you can put on there to help us. We don't have that. So depending on the diagnosis, it could very well be, and it could very well require you to do an appeal on every one of them. Next question.
All right, this one you touched on a little bit, but it's a two-part question. The first part is, where would the insurance types be listed in eligibility? And the second part is, how do we list insurance type on the claim?
Okay. So in eligibility, let's talk about, in the portal user. So the portal is where I always recommend going. Again, look away because I'm going to scroll down to eligibility really fast. Okay, under patient, header, and then eligibility. If we scroll down, and I'm going to scroll down to MSP, so again, look away. If we go to the MSP section of the MSP information, you will see the insurance type code and description. Okay. This is what we're looking for. So hopefully that's going to help you. It's going to be in this tab under Medicare Secondary Payer. This is what we want. Okay. I always tell everyone that if you're looking for where it actually gets billed, those are those two articles that we actually talked about. Because again, most of those are coming in paper. So that's where we have to make sure we're in the correct section. So I'm in part A, we'll start with that one. If I go to Topic Center, I go to Claims, I scroll down, I'm looking for the category, Medicare Secondary Payer. By opening that up, I'm looking for the billing procedures right here. It's the bottom part A, Medicare Secondary Payer billing procedures. Okay. Inside there, it's going to give you the occurrence codes, the span codes, all those different things that you'll need to help you with that. If you're looking at Part B, which is a 1500 claim form or an 837P, then you do want to go to the J5 MAC Part B. Again, scroll down, come to the Medicare Secondary Payer information, and go ahead and look up the fact sheet, which is the middle one, and this will have the loops and segments and all that stuff of where it has to be. If you're not familiar with this at all, You do want to go to our corporate EDI. Now, if you type EDI right here in the top, again, EDI is electronic data interchange. Oops, not sure what I did type there, but electronic data interchange. What they do is they actually take in those claims before our customer service can see them. They take and check all those fields. So it'll tell you all right here. So I just type EDI, I come out, I find out all this information. See how this EDI companion document for the 1500 or the 837s, this is what we're looking for. When we open it up, it's a PDF document and it will tell you, okay, here it is, here's your loops, all those different pieces of information. On here, you're going to want to look at, the fields for other insurance, not 9, but 11. 10 is the type. We're moving to 11 where you have to give us a bunch of different dates and things like that. But hopefully that gives you everything you needed to. So, next question, if we have one, Leanne.
We do, Tom. The question is asking if the timely filing that you had in your presentation also applies to primary, excuse me, is meant to apply to primary claims.
Timely filing applies across the board. It's a universal Medicare standard. So if you are filing primary or secondary or tertiary or whatever for Medicare, you have to follow those guidelines. Now, again, if there is primary insurance and they don't process timely, you need to file the claim and let it deny so that we have it in timely filing. And then we can work with it after you get the information. So hopefully that answers the question. Do we have more questions?
Tom, we do. We have a few. The next one is, can you please go over an example claim for correct billing to Medicare Secondary with the value codes?
I'm not going to do that in this class. What I would recommend doing is taking the YouTube video on billing FIS claims, Medicare Secondary FIS claims. It's too time consuming for me to do it right here, right now. So go ahead and watch that. If you have questions, send it in. Leanne, can we get the next question?
Yes. Are the questions we need to ask the patients in the same location you were just in? And this question came in when you were looking at the manuals.
Yeah, the questions, if you wanted to remember, were within the Medicare Secondary Payer manual. So right now I'm in the claims processing. So let's back up a step. We're going to go to the Medicare Secondary Payer, which is right below it. It's 100-05. We're going to scroll down. We're going to talk about Chapter 3 because this is our billing requirements. And inside Chapter 3, if you don't want to scroll through, just look to 20. And there's our model admission questions. Okay, so 20.2.1, and it'll walk you through step by step each question, yes or no responses. Next question.
The next question is, where can we find diagnosis associated with MSP? And then also, what are occurrence codes and where are they located?
Okay, so occurrence codes are billed on a UB04 or 837I. Best place I can find, especially related to MSP, is come back to that billing article. So again, Medicare, Part A, Topic Center, Claims, scroll down, Medicare Secondary Payer, go to the billing procedures right here, and you'll see that we do list the MSP codes, the type of coverage. Here's your occurrence codes, okay? And what you need to know. So insurance denial, all of that. Occurrence 24 right here, which is the one that says, hey, it applied to deductible. In other words, they're denying you payment because it went to deductible. It could also be they're denying you payment because it's not covered. They're denying you payment for whatever reason. Okay, and then you got some condition codes and other things like that. This is what I didn't want to have to try to get into and where it all goes. So I'm going to leave you with that. And in terms of the diagnosis code, I want to remind everybody that all of that is back in the portal user manual, and you've seen me use that multiple times, so I'm not going to walk you through the steps with that. Next question, please.
Okay, we have a couple that have come in that have already been answered. The next one that has not is for Medicare MSP. The primary was not billed with the G code to indicate FQ billing, and the EUB does not have the G code on it. When billing the MSP, we keep getting rejections because the G code has been added. How do we get around this?
It sounds like a situation where um, you need to document, and then you might have to even do an appeal to say, look, this G code is not billed to the primary. This is what it is. Remember, I said document within why you're changing the code. You shouldn't be adding another code. It should be a change of code, which just tells us literally if whatever the code was, this is the G code that matches to it. That's what the documentation needs to state. So when they're looking at that EOB, they see, oh, I see here versus here. Otherwise, you're basically billing twice for the same service. Again, it could be an appealable situation. I'm not sure exactly what's going on, and that's where I'm struggling to answer that one in that in-depth. You may need to contact customer service with your claim number to find out what edited and our audit it is hitting to be able to get the exact answer for that. Let's take one more question, then we're gonna have to go on.
Okay, Tom, the last question we're going to do is asking when MSP is secondary workers' comp or liability and no fault, how do we submit the claim as primary?
Well, if it's not related to it, again, use the diagnosis code. If it's not related at all, then you don't even have to put information about the primary payer on there. As a matter of fact, you wouldn't want to include anything because it's not applicable. If it is related to it, which is not what you're asking me, please make sure that you're billing all those information if it's a no pay claim, etc. Remember that for a 1500 or 837P, you may need to do an appeal. Remember that for a UB04, 837I, you want to make sure you have the correct occurrence codes. So that's all I have time for today. We're going to go ahead and close out this webinar. Resources are available to you. I've shown you a lot of them, which is why I didn't actually stop and say, okay, let's go through all these different resources. These are just slides giving you the resources so that hopefully you can go back and find what I gave you should you need them. So hopefully that's all going to help you out there. With that said, we've come to the end of the webinar. Hopefully I answered all of your questions. If not, we'll get back to you in email, but I want to remind you to please take our survey. This is an important part for us and for CMS. What it does is helps us understand what you're looking for in the future, but it also helps us understand how we're doing as an overall Medicare administrative contractor and what you thought about this education. So lots of things going on there. The survey can be taken right now. There's a link in the chat. You could also take this survey once we close out. You'll be given a pop-up box. It is not malicious. It's not spam. It's not something asking you for some crazy stuff. It's actually us asking you to take this survey. You'll recognize that box as the left-hand picture. Last, we're going to offer you an opportunity to take this survey on any Encore presentation. You want to look for that online survey picture, which is on the bottom. Also, don't forget to watch for a message from us. Inside there, it'll be a certificate of achievement and a link. That link will take you to this survey. So lots going on with a variety of different things. The certificate of achievement is used for contact hours as well. So don't just delete it if you do need those contact hours. It is time for the Medicare participation agreement for those billing under the Medicare physician fee schedule. If you're interested in changing your participation, it's time to take a look at that. We've provided you with a link on this slide, so take a look at it, grab that information if necessary. Always feel free to use a search engine, look it up that way or anything like that. That's it. I'm done. A couple of things to keep in mind. If you have questions in the next 7 days, feel free to email us. We want MSP webinar in the subject line to indicate that those questions need to come in. If you dialed in, you will not receive that email I talked about earlier. However, what I want you to do is put you need to email us with MSP webinar, just like a follow-up, and then inside the body, give me a phone number if you need a certificate. I need a 10-digit number to verify that. For those of you that are getting it through an email, I don't have any way of verifying your phone number. The only way we have to verify the phone number is if you dialed in and you did not use the email. So please make sure you're doing that. With that said, I'd like to thank everybody for attending and encourage you to take that survey. On behalf of myself, Leanne, and all of Provider Outreach and Education, we hope that you have a great day, and we hope to hear from you in the future on this survey and that you attend our further events. Thanks, everybody. You can now disconnect.